Hi there, my name's Rachna. I'm a GP in South East London and one of the joint directors of clinical strategy at King's Health Partners. I'm going to be telling you a little bit about our webinar series for primary care. So how and why did this webinar series even come about? Well, let's roll back to the beginning of the COVID pandemic when it became really obvious to us at the time. It was so fast paced, we had a new virus, it wasn't really clear how best we should be caring for our patients, that we needed to create a place and a space to bring together experts from across the system to share learning, to share knowledge, and as well as experiences, because we thought that we would benefit from this, but that it would also benefit our patients. So that's how the series came into being. We create really a platform where we can facilitate a conversation across the system, which means having colleagues from mental health, from community care, from primary care, and from secondary care. The emphasis is very much on sharing learning and on experiences and really raising awareness around the topics that are important to us in primary care. And in so doing, we hope that we also help to strengthen our working relationships across the system as well. The webinars are open to all, and you can find details about it below. So what have we discussed so far? Well, actually all sorts of things, a really wide range of topics that of course have covered lots of COVID. We try when we can to always bring in the health inequalities angle because it is so important. So we've talked about COVID across the experience across different settings, about clots and COVID. We've talked about women's health and an area around preconception care and how important that can be as a window of reducing risk for a woman who's about to become pregnant and therefore for her baby. We've talked about children's health and the CHIP programme. We've also talked about areas that aren't so thought about actually in health, so obesity, stigma being one of them. We've also talked about areas that are quite personal to ourselves, so our own mental health and how we cope and what advice is available for people as people working within the NHS. And last year we touched on something sort of niche, but hopefully becoming more important to us, and that is research in primary care and how we increase capacity and capability of that in South East London. In addition to these sorts of webinars, we also have within the partnership an offering on quite clinically focused webinars that are interactive, so you can ask questions to the specialty experts that are involved. And in addition, we also are hosting some short courses, one on pediatrics, one on respiratory, and in May we'll be hosting one on maternal medicine for primary care as well. All of the details of our offerings can be found on this page and on the timetable underneath. Thank you so much.